quite some time before our lives do return to normal. The question on all of our minds is when that could begin to happen. Joining us now live is Dr. Sumner McGee. He's from the University of New Haven's School of Health Sciences. Or she is, rather. Excuse me. I'm sorry. Dr. McGee, great to see you here.
Thank you for having me.
So realistically, I know we're hearing May 20th things will start to reopen, but realistically, what's your gut tell you? How long are we in this?
I think it's going to be a long time before we return to what people think of as normal. I think it could be many, many months, if not a year or more, before we really feel comfortable resuming normal activities until there's a treatment or a vaccine. So we will begin to have more businesses open and have things begin, hopefully, here in the next month or so, but it's going to be a long time before things are like they used to be.
Let's talk about this cure or this vaccine. You know, some are saying it'll be ready in a year and a half to 2 years. Others are saying there might never be one. Why all the different opinions?
Well, this is a brand new virus that no one has ever studied and no one's ever had to develop treatments for. And so right now we're using our most educated guesses based on what we know about other viruses of this type to try to develop a vaccine and to identify treatments. But we're in completely uncharted waters. And so if we get lucky and we find the right way to develop that vaccine, or we find that right drug, it may come sooner. But again, everything we're doing now is just a best guess.
What do you know about who may be more susceptible to COVID-19 and who might be more resistant to it? I know there used to be, when this first happened, there were some reports that if you had type O blood, the likelihood of you getting it was a little bit lower.
What we know for sure is that if you have chronic conditions, diabetes, hypertension, heart disease, asthma, you're at greater risk of developing serious illness, hospitalization, and even death. And so we know that for sure. We've seen that women are having different rates of infection than men. We don't know why men are getting this more than women. There's still a lot of unknowns out there, but we definitely know that if you have chronic diseases, that you're more likely to have a more severe course of the disease.
We're also hearing about this second wave next winter. What do you know about that?
So the second wave is when we do start to go back to normal and we resume our normal activities and go back to work and our children go back to school in the fall, that it will mean that people will get exposed to the virus. And it means that some people will get sick. We're not going to be able to sustain this lockdown that we've been living through for the last month or so forever. So it means that necessarily there will be another peak of cases and illness, but hopefully we're better prepared for it this next time around than we were the first time.
Dr. Sumner McGee from the University of New Haven, we thank you so much for your insight tonight, and best wishes on staying safe yourself.
You too.